Dr. Eric here for part 2 of our vaccine discussion. Part 1, we talked about why vaccines are important, some of the benefits and risks of vaccines, what we can do to help minimize those rare risks for dogs who have had reactions in the past. Then we talked about the core vaccines that every dog should have, including rabies and distemper. Now we'll talk about the non-core vaccines and the scheduling or series of vaccines for puppies and adults. So non-core vaccines are really based on that risk of exposure for that certain disease. So for example, Bordetella, known as the kennel cough vaccine, dogs that have high exposure to other dogs, such as dogs that go to dog parks, kennels, baths, daycare, that sort of thing. They are more exposed to other dogs, so they have a higher risk of getting that upper respiratory tract infection or kennel cough. Now, kennel cough again is a bit of a misnomer. It's not necessarily just caused by Bordetella. Bordetella is just a part of it. It's actually a complex of different diseases that cause upper respiratory tract infections. So Bordetella is a bacteria that causes it, probably the one that gets blamed for it the most. There are other bacteria that cause it. There are other viruses as well. So this vaccine is not perfect. It's not 100% protective against all upper respiratory diseases, but definitely a good idea to have when your dog is with other dogs. Some boarding facilities and groomers actually require it. It is sometimes recommended once a year, sometimes it's recommended once every 6 months, depending on what your hospital or boarding facility requires. Just follow their protocol. There is a either intranasal vaccine where it's a squirt up the nose, or an oral one which is squirt in the mouth. And those are great because it actually provides immunity right to the source of where the problem is, so the whole body doesn't have to really ramp up to provide that protective response. But for dogs who are a little face shy, there is an injection as well. Sometimes they tolerate the needle better than the squirt up the nose, and that one does need to get boosted in 2 to 4 weeks for that to be protective. Another non-core vaccine is Leptospirosis. Lepto is a bacterial infection transferred through the urine of infected animals, including wildlife. So if your dog has exposure to any stagnant water, ponds, puddles, damp soil, that sort of thing, they can be exposed to that. It does cause mostly liver and kidney issues, and they can get pretty sick from that. But of importance, it's also zoonotic, which means we can get it too. So if we're cleaning up their urine and not as diligent about washing our hands, or if we have a cut on our fingers, we can get it too. So that's why that one is strongly recommended. Another vaccine is another non-core vaccine is Lyme. Lyme is transmitted through ticks. Now, Lyme disease is caused by a bacteria called Borrelia burgdorferi, and it really depends on the risk of exposure to ticks. So there are some endemic areas that have a very heavy tick population, like Northeast, so New York, Connecticut, Pennsylvania. Here in Florida, it's not as much of an issue, so I don't really give Lyme vaccines that much down here. But in New York, when I was practicing up there, I gave vaccines all the time, and we saw Lyme quite frequently. The thing with Lyme vaccine, though, is where Lyme disease itself is maybe 90% dogs have been exposed to it, and they will show up positive on the test. But out of that 90%, maybe 10% of them actually develop the disease. And that's partly due to why or how the vaccine is so effective. So that's a good one to have in heavy endemic areas with ticks. Lastly is the canine influenza vaccine, or the dog flu shot. Over the last few years, there have been a couple of outbreaks in the country, one starting in Chicago and one in Florida. So there are lots of hospitals that have bivalent vaccines which protect against both strains, and that would be a good idea. There aren't any extra risks with that vaccine than any other vaccine. And is it if they get exposed to the flu, it's still possible to get sick, even with the protection of the vaccine. However, if they are vaccinated, there'll be shorter duration of clinical signs, less severe clinical signs, and then they shed less virus into the environment, which makes it safer for other dogs. So definitely a good idea, again, especially for those dogs that will be boarding frequently, or goes to daycares, dog parks, and such like that. So those are the main non-core vaccines. As far as puppy series goes, it usually starts around 6 to 8 weeks of age, and that's because when you're first born, they have maternal antibodies from mom that give them protection, assuming mom was vaccinated before she was bred, and so they're protected with mom's maternal antibodies. However, those antibodies actually block the vaccine from starting to take effect. So we can't really start until those start going down, which is around 6 to 8 weeks of age. However, when you start giving vaccines, they're not really protective for like 3 to 4 weeks. So if you wait for mom's antibodies to completely go away, and then you start giving vaccines, there's at least a 3 to 4 week vulnerability period. So what we try to do is to shorten that, is we'll start giving vaccines while we know mom's maternal antibodies are still present, but starting to go down. And then there's a series of vaccines every 3 to 4 weeks until we're 16 weeks of age. That way it shortens that vulnerability period. So by the time mom's maternal antibodies are going down, we're already starting to see some protection from the vaccines that we're giving the puppies. So every clinic might have a different protocol, but typically distemper is boosted every 3 to 4 weeks, and then some of the non-core vaccines, if we choose to do them, are given. Those need to be boosted once 3 to 4 weeks after they're given, until we're 16 weeks of age, and then it's typically when rabies is given. Rabies can be given anywhere between 12 and 16 weeks of age, but most protocols do have that at the last puppy shot series, which is around 16 weeks of age. Adults, once they've already had their puppy series, most vaccines are either repeated once a year or once every 3 years, depending on which vaccine was used. And again, Bordetella is sometimes recommended every 6 months. For adults that have never been vaccinated before, either just adopted from a shelter or with no known history of vaccines, and especially with rabies in the eye of the law, if it's not documented, it's as good as it not happening. So without documentation, we pretty much treat them as if they've never had vaccines before. If they actually had, it's really not that much of an issue. We're not really worried about that sort of thing. We try not to over-vaccinate when we can, but when we don't really know, we treat them as if they're not vaccinated, just for everyone's protection. So that would be a series of 2 vaccines of each one, 3 to 4 weeks apart, and then they're good for a year after that. With rabies, it's one good for 1 year, and then after 1 year, you can repeat the 1 year once a year, or do the 3 year. So one vaccine every 3 years for the rabies, depending on which vaccine is used and is recommended by your veterinarian. So in summary, we talked about why vaccines are important and how it protects immunity, not just for the individual, but the herd as well, or just the community. Risks, again, soreness or sleepiness for a day or so, that's to be expected. But anything else like vomiting, diarrhea, hives, trouble breathing, those are extremely rare. If that does happen, definitely contact your veterinarian right away to get the help that your pet needs, and then follow the steps to minimize that or prevent it from happening in future vaccine visits. Non-core vaccines would be Lyme, Lepto, Bordetella, and Influenza. Depends on the risk of exposure to those certain diseases. core vaccines are the ones that every dog really, really needs to have, and that's rabies and distemper. And then the puppy series, in the article I wrote, I actually jotted down a sample schedule, so definitely reference that. But again, mostly go to your veterinarian. Everyone might be a little bit different depending on the environment and their comfort level with all those things, so definitely talk to them about what's best for you and your pet and in your area. So thank you very much for listening. If you have any questions, definitely reach out to your veterinarian, and there's some really good resources out there. So thank you very much. Take care. Bye.